Okay, cool. So the training we start recording. For today's session, this is the first session out of 4. There's a total of 4 MEDSIS training session. It's usually a 1.5-day training, and we usually do it in person, but because of COVID, and a lot of people are working from home. So we've kind of switched it up a little bit. So for today, we're going to go over MEDSIS overview and also how to enter a new case and how to edit cases after a case is reported. So we'll start with overview. So MEDSIS stands for Medical Electronic Disease Surveillance Intelligence System. It is a centralized system, which means that the system is maintained by ADHS. So it's a homegrown system. We have a dedicated development team with 3 total developers that work mostly on MEDSIS enhancement and fixes. And also all data is housed at ADHS. And we also have a centralized help desk email to help users with any MEDSIS related questions, issue. That email is also open up to any other question that may or may not be related to MEDSIS. We have a help desk analyst who check on MEDSIS help desk every day throughout the day. And his name is Josh. He will triage those emails that need to go to whichever program that sees fit, and the program will then respond. Yeah. So, and lastly, all case information is stored within a single record in MEDSIS. So all of those, we consider MEDSIS a centralized system. MEDSIS is also a secure system. So all users are required to sign an user agreement to include confidentiality guidance and make sure that you guys will follow the confidentiality guideline. And all users must be approved by their local MEDSIS liaison. So for county and tribes, and also hospital reporter who would like to sign up to report for their facility, all new user requests have to be sent to their local county MEDSIS liaison for approval before we grant access to them. And for ADHS folk, the new user requests need to come from your supervisor, so your program manager. So you can either, if any new folks start, you could either sign a user agreement to MEDSIS help desk and CC your supervisor, or your supervisor directly send it to MEDSIS help desk. And that also applies to any additional permission that you need in MEDSIS. It has to come from a supervisor. So the supervisor needs to approve first. It is also considered secure because MEDSIS lives behind ADHS firewall and exceeds HIPAA compliance requirements. Yeah, and ADHS do regular patching to prevent possible data loss. Yeah, so that is what is considered secure. And next is MEDSIS is a web-based system. So all approved MEDSIS users can access the system anytime as long as there is internet access. So you don't need to have to go into the office, or you don't need to VPN in to access MEDSIS or to log on to MEDSIS. And lastly, MEDSIS is a person-based system. It might not look like it, but MEDSIS, the system structure is person-based. So there are 2 types of records that can be created in MEDSIS, a person record and a case record. A person record must be created prior to a case record, which also means that a person record can have multiple different conditions or different cases reported under that record. So a lot of you guys might not know, but there is a person view where you can view by person record, and underneath you can see all the cases that's reported for that person. So next I want to talk about who uses MEDSIS, so who is on MEDSIS. We split it into 3 categories. One is, the first is individual and institution. So in this category, we have hospital, provider office, laboratories, and medical examiners. And this group is responsible for reporting communicable disease, opioid overdose, elevated blood lead, any reportable condition. And this group, they have 2 options for reporting. First is manually enter individual cases into MEDSIS, and for certain morbidity, they have the option to batch create cases in MEDSIS by uploading a standardized batch case creation template. For most of the commercial lab and hospital lab, they are sending, no, not hospital lab, but most of the big commercial lab, they are sending true ELR. I'll explain it later what that means. So if they're sending true ELR, that means that they are sending, there's no manual process in between. Their system, their lab system is automatically set up to generate HL7 message, which is a standardized message language that sends health data. So their lab system send and generate an HL7 message and then automatically send to our ELR team, and our ELR team will then process them through the downstream system. But with COVID, we also, aside from the true ELR, we also start accepting what we call flat file ELR, which is an alternative solution for hospital or other smaller facility or smaller laboratory that doesn't have the capacity to onboard to real ELR. And that process is really similar to batch case creation. So the hospital lab or the smaller laboratory, they can pull their data out from their system in a standardized format. So there is also a template for flat file, and the facility who go with flat file reporting, they have to follow that guidance, how the data should be pulled. And then those will get dropped into the ELR program, and the ELR program will process them through as true ELR. So for MEDSIS user, what you see in MEDSIS doesn't make any difference. Everything looks the same as long as it's processed through the ELR program.
Amy, we got a question. With the patient view, are you seeing cases entered for all morbidities?
So it depends. It depends on what permission you have and what user role you're under. So if you are under FE role, then you can only see communicable disease. Yeah, so it's restricted to what permission you're given. Oh, that question was about if you can see all the cases under person view. All right, so next category is health department. So first, of course, ADHS is on MEDSIS. And we also have all 15 counties on MEDSIS. We currently have 9 tribes use MEDSIS as their surveillance system to track and monitor their cases. And lastly, we have Sonora, Mexico. So this is a little bit unique because MEDSIS is actually the only surveillance system in the US that allow another country to have access. And the reason why we have Sonora is because the number of cases that number of binational cases that we see every year, it makes sense to collaborate with Sonora State Health Department on continuing follow-up on those cases. So all the suspected binational cases should be flagged. There is a binational field in MEDSIS. So any cases that is suspected to be a binational case should be flagged as binational. And whenever a case is flagged as binational, the Office of Border Health, which Michelle is under health, is one of our binational epi, she will get a notification email to review that case and decide whether this should be shared with Sonora or not. And lastly, we have two international referral agencies. So we have CareTB and TBNet. So these two international referral agencies, they help with TB case follow-up. Because TB case follow-up can be 2 years long and people move around all the time. So these two agencies help with TB follow-up once the case moves outside of Arizona, and they will take over the responsibility. So next, now we've talked about who uses MEDSIS. Next, we're going to talk about what is reportable in MEDSIS, what can be reported in MEDSIS. So first we have, of course, infectious disease, all infectious disease, including STD and HIV. And I think a majority of you guys that is currently on this training work under Opioid, which will be the environment that most of you will be working in. Why I including STD and HIV in a smaller text is because HIV and STD cases are not currently managed in MEDSIS. HIV is managed in a CDC system called EHARS, and STD is managed in PRISM. So why do we still have STD and HIV? The reason is because MEDSIS is the only surveillance system in Arizona that allows provider to do direct entry. So in order to streamline reporting for the provider, we open up for them to report STD and HIV as well. And what we are doing is the data that got entered into MEDSIS is electronically sent over to each program. So it will get feed into PRISM and also sent over to the HIV program on a nightly basis. So those cases will eventually make it into their system, which also means that MEDSIS is probably not the best place to pull STD or HIV data, because lab data, so ELR lab data that will feed directly into PRISM and also get sent to the HIV program. So yeah, if you want to look for, if you're doing research on co-infection or something, or other research with the disease that you're focusing on, we will suggest you reach out to the program directly. And next is elevated blood lead. So I think it was 2017, we've added elevated blood lead into MEDSIS. So the environmental child-led program uses MEDSIS to track all the elevated blood lead cases. And so they're in MEDSIS. And then we also have opioid overdose. It was put into MEDSIS, I think it's also late 2017, when governor declared an emergency on opioid crisis. That's when we've added opioid overdose into MEDSIS. And opioid overdose and elevated blood lead both are only managed at ADHS. I know some of the county has started taking over some responsibility for opioid overdose case management or case follow-up, but a majority of them are still done at ADHS. And lastly, we have birth defect registry. Birth defect registry was put into the system in 2019, and the birth defect program is the only program that has access to this module. So they could track all the birth defect record. So each reportable category has its own secure environment in MEDSIS. And for infectious disease, it's split into two. So one is TB and one is non-TB, which TB module or environment only includes TB, LTBI, and TB contact. And all the other reportable condition is under infectious disease. However, early last year, we have split hepatitis C under its own user role. So for the users, you might see Hep C cases as having their own environment, but it's actually still under infectious disease module. It's just we created a new Hep C epi role that can see all the Hep C cases where all the other epi roles can't no longer see Hep C cases. So elevated blood lead also has its own environment, which we call environmental module, and opioid has an injury module, and birth defect has birth defect module. And each module has one user role. So TB has TB epi role, infectious disease or non-TB, what most of the time we call it, is epi role. Elevated blood lead is is environmental epi role. Opioid is injury epi role. BDR is BDR user role. So we have and for non-TB, we also had Hep C. So I think we have 6 epi role so far. And epi users who is assigned with an epi role can see every single cases that is under that module, which is a little bit different from the provider. So all provider are given DE role, or we call data entry role. And DE role, people who is assigned with DE role can only see cases that has been reported by their facility, and they can only search for cases that have been previously reported. So it's more strict and limited. So that is the difference between different roles. We also have a resources user role, which the user who is given the resources role can only see the resources page in MEDSIS, and they can't see anything else. They can't see any data. They can't pull data out from MEDSIS. All right, so let's move on. So now we talked about who uses MEDSIS, what is in MEDSIS. Now I'm going to talk about how data flow into MEDSIS. So we have a few different options. First is web entry. So hospital, healthcare provider, healthcare facility, medical examiner, and some smaller laboratory do web entry, or what we call direct entry, to report cases into MEDSIS. And then we have ELR, either true ELR or flat file ELR. It goes through our ELR program, ELR system called Alfred, and then gets processed into MEDSIS or into PRISM or eCards. So aside from flat file and true ELR, we also have a third process that is going into ELR, is the point of care testing reporting for long-term care and school who is performing point of care tests in their facility. And that reporting method is through a Google form. So the facility will have to register, and then will be a link will be sent to them, and they need to use that form to enter all the point of care tests into the Google form. And then the Google form will then be generated into a standardized spreadsheet that matches with the flat file and then process it through ELR system. And then eventually make it into MEDSIS. So for flat file and point of care, so for point of care, it's currently only available for COVID point of care testing. And for flat file, I believe it's open up to flu and COVID, both flu and COVID. And lastly, we still have some traditional ways of reporting. The facility can fax in their report to either the local health department or ADHS, and our data entry staff will have to manually enter those into the system. Or if it goes to the local health department, then counties or tribes need to enter those into the system. So once all the cases or all the record has made it into MEDSIS, depends on what user role you are approved and depends on which jurisdiction you're under, you will be able to see everything that you need to see. For all ADHS user, you are given all user role to every single jurisdiction. So you could switch between jurisdiction to open up a case, to edit a case. The reason why is because in MEDSIS, a case can only have one jurisdiction at a time. So if it's currently under the county jurisdiction and you're in ADHS user role, you won't be able to edit. You can still pull up the case and review the case, but you can't edit anything. So in that case, you have to switch your user role to other county user role. So if it's a Maricopa County case, you have to switch over to Maricopa County FE role to edit anything. Yeah, so this is the same. This logic applies to all county as well. So if a user from Maricopa County is usually only given FE at Maricopa County user role, which means that they can only see Maricopa County cases. However, with county, there's another exception is if the county has a tribe that is part of their county, the county will automatically get shared for that tribal cases. So let's say Salt River, Pima, Maricopa is in Maricopa County. So any Salt River, Pima, Maricopa tribal case will get an automatically shared to Maricopa County. So Maricopa County FEs can see those cases, but they can't edit. The reason why is because we never release information, either information or numbers based on tribes. And that applies to everyone. Applies to ADHS, applies to county. County don't have the rights to release any number based on tribe either. Neither does ADHS. So that's why in order to still be able to count those cases, tribal cases are automatically shared with the county. Yeah, so once the case is MEDSIS and all the action that needs to be taken care for those cases has been done, we have a nightly automated process to send any national notifiable condition to CDC. And that's what we call case notification. So next, I'm going to talk about how data flow into MEDSIS. So we have direct entry or ELR. Once a case gets into MEDSIS, either through ELR automatically created or was reported directly by the provider, this county will see that case right away. So I want to talk a little bit about the setup. So all the facility that has signed up to report in MEDSIS, they're automatically set up to report to directly reporting to their county. So whichever county the facility is in. So let's say when Banner House reported a case into MEDSIS, because Banner House is in Maricopa County, that case will get automatically sent under Maricopa County jurisdiction. So Maricopa County FEs will see that case right away. And it's the same with ELR. So we have automated process set up to auto transfer a case that is created through ELR to the jurisdiction. And so it's a little bit different with ELR is the auto transfer is looking at patient's primary address. And if patient primary address is not available, then we will use the provider address to automatically transfer those cases. But anyway, so once the case is in MEDSIS and has been under the jurisdiction that is supposed to be based on the data that's available and the logic that's behind that's on the back end, the county can now go into the case to view and decide whether there's any action that needs to be taken care of, whether an investigation needs to be done or they need to reach out to the case to do interview, or for some condition like COXI, hepatitis B, most county will just review it, classify it, and submit it back to ADHS. So if we're talking about cases that need further follow-up, the county will then start the investigation or start the interview. And once the investigation is complete and all the control measure has been done, then the county will have to enter all the information into MEDSIS and local classify the case and submit it to ADHS. Once the case is submitted, ADHS will then review the case and add any additional information that we receive. Either an additional lab will just automatically attach to those cases, or if we got any additional information like the surveillance team has been doing, they have been batch updating race, ethnicity, and hospitalization information back into MEDSIS. So yeah, so we at ADHS, we continue to update these cases. So once this case has been reviewed by you guys, ADHS, then you guys will then state review it and archive it. So once it's state reviewed, it's kind of the same meaning as archiving the case. And then if it's a national notifiable condition, then we will send it to de-identify and send it to CDC. Yes. So I'm going to stop here to see if anyone has any questions. You could also always just unmute yourself and speak up if you have questions. All right, so if we don't have any questions, we'll move on. Yeah, so this screenshot is just to let you know to let everyone know these are the minimum information that needs to be reported by the provider. Otherwise, they won't be able to get past the validation. So demographic information, reporter, and at least one lab is required. So that's a really quick overview of MEDSIS and how the system structure works. Next, I'm going to talk about the health services portal, or you might also hear us say use F5 portal. So the two can be changed, switch between the two, either health service portal or F5. So when we talk to external users, we use health services portal. So if you are communicating with county or tribes, use health services portal. When we usually talk to IT, we use F5. So it's easier to understand for that group. But so health services portal, here is the link, is a portal where the two MEDSIS icons, so MEDSIS training and MEDSIS production live. There's also a SharePoint site that will also be on your health services portal. For folks who has access to the Spanish version of MEDSIS, we'll have two additional icons or two additional options, one for a Spanish training and one for Spanish production. Yeah, so there is a SharePoint site, there is MEDSIS training and MEDSIS production. So you probably want to bookmark this link. So it's an easier access for you. So next I'm going to talk about the two MEDSIS options or MEDSIS icons. So one is MEDSIS training, which is the environment that we will be using today. Training environment is open up to all users to play around with the system, to get familiar with the system. So you could put anything into that training environment. You could do weird things in that training environment without messing up any real data. However, because training environment is open up for folks to do anything in it, we do give a lot more permission to users. So real patient information is not allowed in the training environment. If you ever accidentally put in real patient information into the training site, let us know immediately, or whenever you notice that you accidentally put real patient information. Email the MEDSIS help desk, let us know immediately the MEDSIS ID of that case, so we could get those hidden from the training site. So that's just a reminder to everyone to not put real patient information in. And if you accidentally did, let us know right away. The other icon is MEDSIS production. So that is the environment where all the live data or real data lives. And that is also where you will be working on like case investigation, contacting patient, entering case information, managing outbreak, managing cases. They're all done in the production environment. So next, I want to talk about different ways of communicating in MEDSIS. So first, we have MEDSIS homepage. So MEDSIS homepage is, we post MEDSIS announcement on MEDSIS homepage. So this MEDSIS homepage is the page that you see when you first log on to MEDSIS. We will post any upcoming system upgrade, any upcoming system system downtime, any upcoming meetings, MEDSIS meeting, they'll all be posted on the MEDSIS homepage. And the recorded quick start MEDSIS training is also posted on MEDSIS homepage. So if you didn't notice that there is a MEDSIS training on there. We also had a recorded training video for healthcare provider that is also posted on the homepage, but it's only available for provider. And next we have secure messaging system. I don't know how many of you have used secure messaging system in the past, but it is available. It is a secure environment for users to send confidentiality information to another MEDSIS user. So you don't have to be afraid that you forgot to encrypt the email when you send identifiable information or patient information. If you send it through secure messaging, it is considered secure because it is within MEDSIS and it's behind the ADHS firewall. And on top of that, every single user has to log on to access those access those messages. So it's a great way to communicate with internally or with external partners. Next is email subscription-based email notification. So on the MEDSIS, under your name, when you open up the user role drop-down list, there is a email subscription that you could click on. So how this subscription-based email works is users can subscribe to the morbidity that they care mostly about. So for VPD team, you probably want to subscribe to measles. So whenever a measles case is reported to your jurisdiction, you'll get a notification email sent to the primary email that you prefer. Most of the time, it is your work email. Yeah, so you don't have to log on to MEDSIS to know about that case. You could just, it'll just get sent to your work email and you will know that, oh, there is a measles case. I probably want to log on to MEDSIS to check it out and see if there's any additional action that needed to do with that case. But you probably don't want to subscribe to flu and definitely not to COVID right now because you'll be getting thousands of emails every day. So users have the option to subscribe and unsubscribe to email, email based on the morbidity. Aside from that, MEDSIS also automatically sign every user up for notification email for any new secure message that were sent to you into your inbox. So you will also get a notification email from the MEDSIS system with a like really short sentence where like, oh, you got a message, secure message from the user's name. You probably want to go in and check your secure messaging inbox. So all the notification email doesn't include any confidentiality information or patient information. So it is considered secure. Lastly is the resources page. So the resources page, there are a few different folders that is shared globally. So the MEDSIS documentation folder has a lot of MEDSIS related information. We have tip sheet, user guide, all the training slides, and all the data dictionary. They're all saved in MEDSIS documentation. We also have a surveillance folder where the surveillance team will drop any useful resources into that folder. And we also have a state lab folder that I think VPD team do drop information into that folder, and also surveillance team also shared lab information into that folder. So external users, county users, and tribal users can access those. And on top of that, every jurisdiction also has a shared folder with ADHS for each environment. So there is a non-TB folder, there's a TB folder, there's a syndromic folder. Oh, no, not syndromic, actually. There is an injury folder, and there's an environmental folder. So if you only have epi role, you can only see the general county folder. If you happen to have injury epi role, you will see the injury county folder. So the restriction on rules also applies to the share folder, what share folder you can see in the system. Yeah, so those are the few other ways that you can communicate within MEDSIS. this last thing I want to remind everyone is, if you are planning to send identifiable information or confidentiality information that has patient information in it, we suggest that you send it through secure messaging if the receiver is also a MEDSIS user. Because when you send identifiable information from your work email to someone that is outside of ADHS, that is not considered secure, and there is a possible risk of data slipping through the crack, which is a data security issue. But if you are just emailing from your ADHS email to another ADHS folk, you don't have to encrypt your email, or you don't have to secure your email, because we are considered under the same domain, and that is considered secure when you are emailing under the same domain. Yeah. So this is the last slide for this slide deck. This is the email help desk email. You'll be seeing this slide throughout the training, but the same. If you have any question, any issue with your password, any question related to MEDSIS, feel free to email the MEDSIS help desk. All right. Any other question before I jump over to new case entry and case edit? All right, if we don't have any questions, I will jump over to case edit and case entry. So after I go through the slide, I will do a demo that you could also follow along. Okay. So, and we are switching to another slide deck in case you are not aware. So we'll go through it pretending that we have a case that we need to enter right now. So the first thing you want to do is always do a search before you enter a new case. So you want to make sure that, is this a case edit or is this a new case? And on the handout, there is actually a how-to to teach people how to search for existing case. So there are usually 3 ways that we would like people to perform the search before they actually create a new case. So the first one is search for the exact name and date of birth, which is the most restricted way of searching for existing case. If that doesn't bring anything up, we would prefer you to do a second search, is to search by the first or the second or the third letter of each name and add a wildcard. So add an asterisk either in front or behind the first 2 letter or the last 2 letter that you're searching for. This will broaden up the search result, which will later on prevent more duplicates being created in the system. And if you know that that case exists in MEDSIS, but it's just not pulling it up, the last solution will be search by date of birth. You might get a whole lot of cases pulled up, but you also might be able to find the case that you're looking for just by searching for the date of birth. But yeah, that is the 3 ways that I just went through are the recommended searches that needs to be done before the case creation.
If someone's asking for an example, you're just going to do that in the demo?
Yeah, I will do the demo on how to search when we get to actually start working in MEDSIS training. So. So now let's say we've done a search, the case is not there. What we have to do is we'll have to create a new case. So it will be under the Cases tab, and on the upper right-hand corner, you'll see an Enter New Case button. So you'll click on that, and then the system will actually force you to do another search first before you move forward. Yeah, so, and in the next few slides, I'm going to walk through all the requirements field that you need to put in order to report a case. So, of course, first name, last name are required. Gender, date of birth are also required, but can be unknown. And next is patient county. So patient county cannot be left blank. The reason is because we rely on the patient county to determine which jurisdiction this case should be either transferred to or should be automatically sent to. That's why county is required. And also, we use this county to do case count. That's also why county is always required when you manually report a case or the provider decided to go with batch case creation, or if it comes through ELR, county is still required. So yeah, so if you think about this, whenever you are going to create a new case in MEDSIS, either through ELR, through flat file, through batch case creation, or manual entry, the county needs to be there. So you may ask, what if patient address is not available? And most of the time, they might not be available, especially with COVID. And also, when the data is coming from commercial lab, and if the hospital didn't pass that information over to the lab, then we're not going to get that information. So what if the patient address is not available? On your handout, there is a table, and you'll see there's an order column. So I'm going to walk you through the order that we should go through to identify the county field. So first, of course, is in the ideal situation, county of the patient self-identified primary address will be our top pick. So if there is a physical address that patient confirm or patient self-identify, we'll use the address to determine the county. If that is not available, because a lot of times that might not be available, if the patient PO box or mailing address is available, we will use that address or PO box to determine what the county is. And we do put in the PO box as an address in the address field. If that's still not available, the third option is we use the physician or provider office address to determine the county. So let's say this patient was seen in one of the clinics in Maricopa County. So we'll use the clinic's address to determine, okay, this clinic is in Maricopa County. So we'll put Maricopa County as the patient county. But we are not putting the provider's address into the patient address field, just the county. If provider office is not available because provider is actually not required to report a case, so that can be the case that there's just no address. If the patient goes to school, we will use the school address to determine which county that patient primary county should be. If that's not available, we'll then move down to if the patient is admitted to a hospital or a clinic, we'll use the hospital address to determine county. Lastly, the very last option we have is to use the laboratory or the reporter who reported this case address to determine which county this case should this which county should be marked as a primary county for this patient. The reason why we put reported last is because, especially with ELR record, a lot of the lab tests was sent out to out of state. So we'll end up with an out of state address, which this patient can live in Arizona, but that will end up looking like an out of state case because we use the reporter's address to determine county. Yeah. So that is the way to identify county if patient address is not available. Next, we have next of kin. We have a next of kin table and an insurance table. So both tables are not required during new case entry, but if you happen to have the information, we do encourage you to put it in. To create a next of kin, first name and last name are required, so you do have to have a first name and last name. And to create an insurance record, funding source and insurance type are required. So, but it is overall, the table is not required. Next is the disease report. So each case that you are about to report need to have at least one disease report associated to that patient information. And within that disease report, at least one lab is required to save that disease report. And within the disease entry form, so this lab is a lab table under the disease report. And within the lab entry form, test performed and test result are required. So you need to have those two to save a lab observation. And so this is on the screen. It is an example of the paper form that we usually receive at ADHS. So what we ask people to do is you enter all available information into the lab observation. So whatever the test name is showing in the lab, paper lab, you will enter exactly as it is into the lab table. It's the same with result. So this slide is just a quick reminder that always remember to click on apply to properly save the lab observation that you just entered. Otherwise, it's not going to let you save the disease report. We do get a lot of people asking that, oh, it is not, I've filled out everything, but I can't save it. A lot of the time, I think 3 times out of 5, it's because they didn't click on apply to properly save that observation to move forward. So after you click on apply, you should see a new role show up under the lab table. So this is also how you confirm that the lab has been properly saved. So next, I want to talk about what if the paper form that we got has multiple labs on it? What do we do? So the answer is that each lab needs to be entered into the lab observation table as a separate observation. So it will look like the screenshot on the slide. You have to split it into its individual role when you are entering multiple labs. So next, after the lab, you will see reporter and provider. So first, I'm going to talk about what is the difference between reporter and provider. So listen carefully. The definition for provider is the person or facility who diagnosed the patient. What about reporter? The definition for reporter is the person or facility who report the case to public health. And reporter is required. And for a provider who is manually reporting or fast reporting, their name is automatically filled in as the reporter. So they don't need to search for the name and associate themselves to that case during reporting. So reporter and provider may be the same person, depending on who diagnoses the patient and who reports. For a lab report, the provider is usually the submitter or the submitting facility who submitted that report, who ordered that report. Yeah. So I have two scenarios. So first, if an urgent care provider call ADHS to report a case of pertussis, who is the provider, who is the reporter? Let's start with provider. Who do you think the provider is?
Urgent care.
Yes, the provider is urgent care. What about the reporter?
Also urgent care.
Urgent care.
Right. Yep. So in this scenario, both provider and reporter are the urgent care, so they're the same. So question 2, if La Paz County call ADHS to report a case of E. coli from La Paz Regional Medical Center, who is the provider and who is the reporter? We'll start with provider again. Who do you think the provider is?
Medical center.
Correct. Yep. What about reporter?
The county.
Yeah, we got you there. It's not the county. Remember, the definition for reporter is whoever reports to public health. The county is considered public health. So the reporter will be whoever reports to La Paz County. So it could be, most of the time, it could be the La Paz Regional Medical Center, or if it happens to be another clinic that call La Paz County, that will be the reporter. Does that make sense? Or is that still confusing?
Makes sense.
Okay. So you may ask, so will there ever be a time where the reporter will be the public health? The answer is actually yes. So mostly for tribal entities, when the health department also run their own clinic. So for a lot of the tribes, they actually have their own clinic within the health department. Then in that scenario, they will be reporting to themselves. All right, so that is, we clarified the difference between reporter and provider. We'll move on to talk about how to associate provider or reporter. So if you have entered the case in MEDSIS in the past, you might notice that you do need to do a search before you can select a provider or a reporter. That is just to prevent more duplicates being created into the system. So you might ask what to do if the reporter or the provider, oh, that's a typo, sorry, is for reporter or provider does not exist in the system. So on your handout, there are a few things that you need to fill out. So the answer to that question is users can add new provider, but cannot add new reporter. So provider, you could always just click on, there is a button that is called new provider that users can just click on if they didn't find any result back with their search, and then create the new provider. However, with reporter, it's a little bit different. If you can't find a reporter in the system, there is a new reporter option that we encourage users to use in order to move forward with whatever they're doing. So you will be searching new reporter for the reporting facility and first name new, last name new, and you'll bring that new reporter up. After you associate new reporter, email MEDSIS Help Desk with the new reporter name, facility name, address, phone number, and MEDSIS ID if you want us to update the case after we added the new reporter into the system. Here I want to also mention that reporter and provider search you can also use wildcard to search for reporter and provider. Because the reporter and provider search has to be 100%, the search that you do has to match 100% up with the record that already exists in MEDSIS. So we always encourage users to do wildcard search, especially when they're looking up reporter, because if you actually look close enough or you have been associating reporter in the past, you've noticed that there's a lot of duplicates in the system. That is a result of we opening up to everyone to have free access to add new reporter. That's also why we start locking it down to not allow people to do that anymore. For ADHS folks, we also have a Google Sheet that is open that you can add any new reporter information into that sheet. And our help desk analyst, Josh, he will add those into the system for you and update the case for you. So if you ever need to add a new reporter, we can share that Google Sheet with you. So next, so that is the last step, is to associate a reporter and provider. And then you could go ahead and report this case. So after a case is reported into the system, if you enter that case under ADHS user role, that case will stay under ADHS jurisdiction. So now the case is entered. What do I do next? So I've had local classification here is because this slide is usually used for statewide training. But for ADHS folks, we will only be touching the state classification. So only in a few different scenarios, we will be making changes to the local classification, and that is during merging. Other times, we don't touch local classification at all. It's the same with county and tribes. They don't usually touch state classification field. The only exception is when they have to merge a case, and if there's any data discrepancy between the two cases or however many cases that they're about to merge, then either ADHS will have to make the call, which local class to go with, or the county has to make the call, which state classification to go with. Aside from the state classification field, case management is also a section where it is not required, but is available for users to utilize to track their cases or to document all the effort that has been done for this case investigation. And which means that there isn't a strict rules or guideline on how each section within the case management should be used. It could differ across jurisdiction. So how ADHS is using it, how VPD program is using it can be different from how foodborne team is using it. So we don't have a strict rules on how you have to use it. It's really up to the program. As long as you get an agreement among your program, and also you've worked with your county and tribal partner to get an agreement how that should be used, the MEDSIS team is okay with whatever you come up with. And the last is DSO. So most of the time we'll say DSO, but DSO stands for disease specific observation. It has its own section in the case, And because it's disease specific, which means that it is associated with the whatever condition that that case is, which also means that because it's tied to a condition, if a person accidentally created a case under the wrong morbidity, we cannot change the morbidity. The user will have to re-enter that case into the system. Yeah. And another thing on top of that is, in MEDSIS, we don't delete any cases. So if a case were reported by accident or was reported under the wrong morbidity, the protocol is to go into the case that shouldn't be in MEDSIS and mark it as not a case and move on. Yeah, so just to let everyone know, we don't delete anything in MEDSIS. All right, so next I want to talk about jurisdictional action. Don't know how many of you are already pretty familiar with this, but we have 3 different ways of sharing, communicating cases with other jurisdictions within a case. So we have transfer, shared, and submit. And how you transfer, share, or submit a case will impact what you see or what the county sees in their reports and extract. So that's why it's really important to know how these work and how these affect the data. So first we'll start with transfer. So transfer is the first icon to the left. When a case is transferred, what get updated? So the primary jurisdiction get updated. And because the primary jurisdiction get updated, that means that the edit rights are lost after the transfer. But user always has the option to keep a share after the transfer. So for example, I'm in ADHS now. I went into the case. I identified that this is a Maricopa resident. This needs to be transferred to Maricopa. So I go to jurisdiction section and transfer it to Maricopa. After the transfer, the primary jurisdiction will now be Maricopa County instead of ADHS. And after the transfer, if I am under ADHS epi role, I no longer have the added rights to that case. But because I have ADHS epi role and you all also have ADHS epi role, you can actually see every single case that is in the system. So it is always shared with ADHS. And next, we'll move down to share. So this might not apply to most ADHS folks, but this can impact what local jurisdiction sees. So I still want to go over it. If a jurisdiction share a case to another jurisdiction, the primary jurisdiction will be capped. And edit rights will also be capped. And whichever jurisdiction that got a shared view have read-only rights to that case. This is mostly when user mostly share a case when this case is involved in a multi-county outbreak, where they think it will be useful for the county that is doing outbreak investigation to see that case, and they could go ahead and share it. And aside from that, I've mentioned earlier, all the tribal cases are automatically shared with the counting county. So, which that one is not removable. So county or tribes cannot remove those automatically shared action. But if it's manually shared with another jurisdiction, the jurisdiction can remove that. And lastly is submit. So once a case can be closed by the local jurisdiction will go in, review the case, move the investigation status to complete, classify the case, and submit it to ADHS. once counties submit the case to ADHS, the jurisdiction will get updated to ADHS, and edit rights are lost after that action. However, county users who submit that case can retract that case to regain edit rights. Yeah, so county does have the option to take that case back after the submit. And I think a lot of the county user doesn't realize that. So if you ever got a question from counties or tribes, just let them know that, yeah, they have that right. They don't have to come to us to get approval to get that case back.
There's a question. If ADHS is editing a case that is read-only, do we transfer or submit the case in order to edit?
So no. That's why all ADHS folks are given all the county FE role. So you will have to switch to whichever jurisdiction that the case is currently under. So for example, I have to update this case that is in Pima County, but I went into MEDSIS under my ADHS role to find that case. You then figure out, oh, that's actually in Pima. I have to switch my user role to Pima County and bring that case back up to edit that case. Right, so next, moving on. We're almost done.
Sorry, Michelle, apologies. We would edit under Pima County for that example?
Yes, you will under Pima County, because we don't want to mess up county or tribal's workflow when it is still under their jurisdiction. So that's why if you're with ADHS, you always switch your user role under the jurisdiction to make changes. And if after they submit it, it doesn't matter. You could just, yeah, you have to go under ADHS user role. All right. Any other questions before I move forward?
Nope, that was the only one.
All right. All right, so we're almost done here. So before we close out this case, there's a few things you want to check. First is that make sure that this case is under the appropriate jurisdiction. And if it's not, transfer this case to the proper jurisdiction. So this is especially for tribal cases. There are a lot of challenges identifying tribal cases. So if you happen to be able to find out that, okay, this is actually a tribal case, during investigation, please remember to transfer that case to under tribal jurisdiction so tribes can see those cases. We currently have 9 tribes on MEDSIS right now: Gila River, Navajo Nation, Tonto Apache Tribe, Tohono O'odham Nation, Salt River Pima Maricopa, San Carlo Apache Tribe, White Mountain Apache Tribe, Hopi Tribe. What is the last one? Oh, shoot. Dang it. Dang it, I forgot. It'll come in my mind later. I'll let you guys know when I remember. But yeah, anyway, so after you confirm that all the information is there and the case is under the correct jurisdiction, the last thing I want to talk about is out-of-state cases. So this is mostly for ADHS, this is mostly just a reminder and just a knowledge, so if county or tribe ever reach out, you know how to respond. So for all out-of-state cases, they need to be transferred to ADHS and not submit. So a lot of time, county will just submit those out-of-state cases to us. They shouldn't be submitted because when we do case count, we actually go by submitting county. So if they actually submit that case to us, it will be counted as under their jurisdiction. So that's why always, always, always transfer an out-of-state case to ADHS and not submit. So this is just more for a county, what ADHS do with the case that they submitted. Most of you guys are already doing this, so I'm not going to go into this part. And it's the same. This is also for county mostly. So yeah, so last slide is knowledge check. We're going to test you on if you remember all the required field to report a case. So on your handout, there's a table, there's another table. So what do you think the first one is? Patient's
Name?
Yep, patient's first name, last name. Second and third, it could be reverse.
Gender?
Gender, yeah, gender. And what is the other one that can also be unknown?
Phone number?
No, date of birth. So yeah, so patient first name, last name, date of birth, gender. Date of birth and gender can be unknown. What about the next one that used to determine counting county? Patient.
Address?
Yes, more specific, patient primary county. What about next one? Based on lab results, it is determined. The answer is actually already there.
The outcome of the test?
No, the morbidity. Yeah, you need a morbidity to report a case. So you need to know what condition. So yeah, that's a morbidity. And the next one I didn't really talk about, but there are 4 dates in MEDSIS. Onset date, diagnosis date, result date, and date collected. So those 4 date field, you need at least 1 date to complete the entry. And after a case is created, the system will calculate and take the earliest of the 4 date that got entered and make it the event date. So we always have a date to do analysis on because we don't always have onset date, which is usually the date that we usually use for public health analysis. But with surveillance, it's really hard to get complete data, as most of you might already know. Yeah, so that's how the calculation works. That's how event date is calculated. Yeah. And next is at least 1, what is required?
Lab result?
Yeah, at least 1 lab observation is required. And the last 2, provider information. We had a note there, not required but recommended. And last one is reporter. So that's about new case entry and case edit. So now I'm going to jump into the training, the system. So to do a demo, if you want to follow along, feel free. And the MEDSIS training is actually here, if you didn't notice. And it's also in production, so. All right, so I'm going to walk you through how to enter a case and case edit. So, like I said, how to enter a case, go under Cases tab and click on New Case Entry. And it will always force you to do a search. I'll put Harry Potter. I'm pretty sure this person is in it multiple times. Yep. So if the patient that you're searching for already exists, this is what you will see. So what you can do is just go in and find the right person. So let's say this is the person I wanted. So I'll click on select. And once you click on select, it will tell you, okay, this person actually have a COVID case that's already reported. If this is the case that you are looking for, you want to add it, you can go ahead and click on select and it will just bring up that case. If not, you can just go ahead and click on new case, enter new case. And because this is an existing person record, so all the person information is already automatically filled in, so you don't have to fill those in. However, if you have additional information, it is encouraged to put those information in. And also, if the primary address is different, you probably want to make a new primary address. Let me go back. Yeah, but if you can't find the person record in the result, you could just go ahead and click on new patient, and then it will pull up a brand new case entry form. Let's see. So but I know that this person exists, but it's not pulling up. Maybe it's spelled in a different way. And I want to use wildcard. So how do you use wildcard? I'll search for my name because I know I'm in the system under training multiple times. So I will put, let's say I just put the first two letters of my last name and the first two letters of my first name and add an asterisk or a star sign and click on search. And here it will bring up all the matches of my search. So you can see the very last one. Let me see, the very last one, it actually bring up a different record that with a different last name. So because I searched with LA and an asterisk, so it will bring up any last name that start with an LA. So that is what we call wildcard search. And you could also always put the asterisk in the front and do a search that way. Or you could always just search by, I don't know, date of birth, and it will just pull every person record that has a date of birth of January 1st, 2000. Yeah, so that's how you do a search. I am actually going to switch to a data entry role because we have different program on this training. So I want to make sure that I touch on all the different reportable conditions. So let me move quickly through this part. Yeah, so you can see before when I searched for Harry Potter earlier, I actually got a lot of results, but now I'm under Banner Desert, I only see 2 Harry Potter. That is because the restriction that we had for provider or for DE user is they can only see whatever they previously reported. So let's treat this as a new patient. So we'll click on new patient, and first name, last name is required. Gender is also required. Can be unknown. Ambiguous is here, but it is only available for BDR. So if you are not reporting any BDR record, you cannot move forward if you select ambiguous. Epi users that doesn't have access to BDR, if you're entering a case, you can't see the ambiguous option because that is hidden for BDR user only. And date of birth is also required. So, but it can be unknown. So if you don't have it, you could always just check the checkbox. But if you do, we encourage. And next you will see an aliases table. So aliases table is actually very important. It's a place where we can record every name combination that it has been reported in the past for this person record. And whichever name combination that is saved in the alias table, the system take those names into account when user perform a search or when ELR automated process is trying to find matching, or for merging, when the system is trying to find eligible merging, all the names that is added to the aliases table are taken into account when the system do a cross match. So that's why it's always very important if you run into a different ways that the patient name comes in, you always want to add it in as an aliases instead of correcting the primary name. This also prevents people from searching under a different name when the name was written as Harry Potter in the past, but then someone accidentally corrected to Harry James Potter as last name, Harry Potter, yeah, as the first name, Harry James, and people can't find that case and can no longer find that case. So, yeah. So that's the aliases table. Next is the contact. So this is where you have to fill in the county field. If you don't, it's not going to allow you to move forward. But most of the time, we tell people to, if they have the address, we tell them to put it in. And after the last part of this, you'll see there's a reservation field. And later on, under demographic, you will see a tribal affiliation field. So you may ask, what are the difference? So reservation field, the definition for reservation field is whether this patient resides on tribal land or not. So if this patient happened to be a tribal member, but they live outside of tribal land, that information should go into the reservation field. If this person lives on tribal land, but they're actually not a tribal member, that could happen. It's rare, but that could happen. The address should still be marked as, let's say, because it's in Maricopa, it's in Salt River, Pima, Maricopa. Even though this patient is not a tribal member, but they live on tribal land, the reservation field still need to be filled out as Salt River, Pima, Maricopa. We use this field to determine whether we should transfer this case to the tribe. So that's really important. Yeah, so I'm just going to make this a tribal case. And then next you'll see primary phone number. Phone number is not required, but is recommended. And then you'll see primary work phone, primary cell phone, other phone, and primary email. They're all not required, so, but if you have it, it is always encouraged to put that information in. And next we have next of kin, it's not required, we touch on that. And then we have demographic section. So here you have occupation, school. So school field is actually intelligent, which means that as long as you are typing, it will pull up the matching name, school name that you could select from. Or there's always an other. So if you use other, then there's a specified field that you could put the actual name. We have living situation, document if this is homeless, this person is homeless, race, ethnicity, tribal affiliation. So tribal affiliation, as I mentioned, is a tribe. If this case is a tribal member but doesn't live on tribal land, you want to put that information here. But if this is a tribal member but they live on tribal land, you could still put that information here because they're still a tribal member. Yeah, so language, can interview in English, yes or no, or dead field. So this dead field is actually whether this patient passed away or not, and not whether this patient passed away because of this condition or not. There's a difference. There is a separate field after the case is created that's called outcome. And outcome field, the definition for outcome is whether this patient diseased because of the reportable condition, which is different from the death field. So a person can die because of other reason, they went into a car crash and they passed away that way. In that scenario, you will want to mark that field as yes, but you probably don't want to mark that outcome field as died. But after you select yes, you can put in the date of death and the death certificate number. And insurance, under insurance, there is a, go back a little bit. So up until demographic, anything from demographic and above are patient record information. Anything below are case-based information. So first you'll see insurance and then medical record number. Provider can actually enter medical record number during their entry. We're trying to ask them to include it as possible every time if they have it on hand, so it's actually easier for us to follow up on cases, but it's a hit or miss. Most of the reporter is pretty good at filling those information out, but just to let you know that it's not required. So you might still need to request medical record. And next is disease report. So this is where you will actually select the reportable condition you are reporting for. Also, just if it's not confusing enough already, because I'm in data entry role, so when I click on add disease report and I search for LT, like if I search for elevated blood lead, it will show up, or if I search for overdose, it will show up, or NAS. NAS, it will show up. It's because I'm under data entry role. And the user can see all the reportable condition. For a public health user or for user who is only assigned with epi role, if you only have epi role, you can only see all the infectious disease and not excluding TB. If you only have injury epi role, on this page you can only see neonatal accident syndrome, opioid with and without fatality. If you only have environmental epi role, you can only see the 2 elevated blood lead morbidity. So next I want to talk about more general morbidity. I'll use botulism. So botulism, I selected morbidity, and then the system will automatically take me to the disease entry screen. Here is where you'll start entering those information: onset date, diagnosis date, age at onset. So if you doesn't know the date of birth, but you have the age at onset, you could put that information here. If you don't, it's totally fine. It's not required. You can leave it blank. Next, we have provider callback number. I actually don't know how often we got this field filled out during new case entry, but we do get this information via ELR from some of the commercial labs. And there's a comment section. You could put any additional information that has not captured elsewhere into the comment section. Sometimes provider will actually copy and paste the entire medical record into the comment section. It's not great, and it's not ideal, but we don't really want to stop them from doing it, as if we could get more information, we're always open for more information. So, but just to let you know, you might see the entire medical record get pasted into the comment section. And next is the lab table. So here, you will start putting in the lab information. I don't know, PCR, positive. So for most of the morbidity, the test performance test results are free text. So you can literally put in anything. Let me finish this first. So I'll put in date collected and result date. I'm not gonna put in those two dates for now, and I'm gonna click on apply. And then under here, you'll see provider. So here is where you will have to associate a provider. So I'm just going to search under unknown and see what come up. Okay. So unknown, Banner, Desert. I'll just pretend that that's the provider that I'm looking for. But you can also always search by wildcard. So if I search for Arizona, I didn't finish the spelling, and I search, it will bring up all the facilities that start with ARIZON, and all the providers that already exist in the system. If you can't find it, you always have the option to click on new provider, to create a new provider. Or you can always do a new search. The reporter is autofilled because I'm in a data entry role. Like I mentioned, reporter is always autofilled with whoever is signed in. And here you can attach either the lab report or the medical record along with the disease report. So now I'm going to click on save. It will tell me that you can't save because none of the date was filled out. So what I'm going to do is I could either, if I have the lab date, I will go in and put it in. If you have all 4 dates, please go ahead and put it in. If you don't, fill out the ones that it's available. Okay, so now I can save. So that is one example for most of the infectious disease. Next, I want to go over one of the opioid morbidity. So let's say I'm going to report for opioid without fatality. Most of them are the same. The only difference is for opioid, lab is not required. So the reporter doesn't need to add a lab observation into this lab table in order to save a case. Additionally, for all opioid overdose with and without fatality and neonatal abstinence syndrome, they all have a mini investigation form underneath the lab table. And this is the exact form that you will see if you bring a opioid case up under injury epi role under the DSO section. So, but we do, because for opioid, the requirement is a little bit different and they need to report additional information. That's why we've created a mini investigation form for the provider. Yeah, so all the rest of the logic is the same. Reporter, if they're logged in as DE, they don't need to try to find it. So I'm going to click on save. So that's for our injury. And next, I'm going to novel coronavirus. You probably are pretty familiar with this one. So yeah, the different part is for COVID, we actually have a standardized drop-down list for test performed and test results. So you have to select off of the standardized drop-down list. And click on save. Yeah, so those are a few different environments. Let's see. I'm not going to go over BDR because I don't think any of you will be working on that. Let's see, what else? Oh, for TB, tuberculosis, tuberculosis also has a standardized drop-down list for test performed and test result. On top of that, they actually have additional fields in their lab entry form. stationary source site and some additional section like the susceptibility section. So it's different. But that is how you add disease report during new case entry. And you can add multiple disease report, and however many disease report that you add, after you click on report cases to public health, each disease report will then get created as a case in the system. So let's go ahead and, let me scroll back up a little. I want to touch on this before we move forward. So let's go back to the contact address section. You can see that street and unit, we have it as free text. Is because we allow descriptive addresses, because we have a lot of tribal partner on the system. And if you are familiar, a lot of the tribal land doesn't have addresses. So the PHN with the tribe that they could put in 2 miles down the chapter house or 2 miles down the traffic light to document where that person actually lives. So that's why we kept it free text and descriptive, so people can put in descriptive addresses so that they could follow up later. That's also another reason why it is really hard to identify tribal cases, is because a lot of the tribal cases doesn't have an actual address, or they will have a PO box, which is not usually the location that they actually live. So that's why always, if you happen to know tribal information, we encourage you to put it in. Anyway, so now we're ready to go ahead and submit. We'll click on report cases to public health and click on, so if you've reported multiple cases, this is the screen that you will see. It will list out all the 3 cases with the assigned MEDSIS ID and all 3 other options that you could either report another case for this patient, or report a case for a different patient, or go back to the cases screen. So let me go back to the cases screen actually. And I want to show you that because I'm under DE role, provider who are given DE role, they can't edit anything. This is what they see after a case is reported. They could only bring up a CDR view to view what they have entered. So I don't know if any of you do get emails asking that they have to correct something. That's why they're emailing. It's because they can't edit after the case is reported. So either the county who got the email or who got the phone call need to go into the case to make the change, or if you receive the email or the phone call, you have to go into the case and make those changes. So I'm actually going to switch back to Epi role so I could actually open up those cases. All right, so I'm going to go into COVID. Because we need more COVID, right, in our life. It is slow. Okay, cool. So right now, because I'm under ADHS user role, it's telling me that I can't edit because I'm not the primary jurisdiction. This is a trick. So if you go to the hyperlink and copy the hyperlink and switch it, I think it's Maricopa County, and switch it to Epi at Maricopa County and paste the hyperlink, you could pull up the case right away. So you don't have to do, after you switch the user role, you don't have to do a search again to pull up that case. So now I'm in the case, and this is what it will look like after a case is actually created. You'll get a MEDSIS ID assigned, and the morbidity that is for that case will be listed. and now you have an event date. So it is calculated, it's taking the earliest of the date that was reported. And I'm going to skip through all the things that we've talked about, and go to classification section. So in this section, this is where you'll find the two classification fields, state classification and local classification. As for ADHS, we'll only be working on state classification. We also have disease import, whether this case was an imported case from out of state, out of country, out of county, or in-state, in-county, in-country, in-county, sorry, there's no in-country. And this is the binational field that I was talking about. And this is how the system flags binational cases to notify Michelle is by this field. So if I go ahead and mark this binational field as Mexico, and I click on save, then the system will automatically trigger a notification email to send to Michelle, and then she'll know that to go in and check on this case. In addition to that, after a case is marked as binational, either Canada or Mexico, there will be a binational data section that show up where it will capture more detailed information on how we determine whether this case should be binational or not. So that is binational field, and anything that's associated. I'm going to move back into unknown. And then we have detection method. How was this case detected? Through lab, through outbreak, medical record review, etc. We also have, is this patient immunocompromised? And then investigation status. So investigation status is always default to new when a case is first created. Depend on how the county would like to use this field, they can move all the active cases that they're currently working on to active, or they could leave, some county actually leave it as new and use active in a different way. So it is not the same across. So I just want to make that aware, that you are aware that each county has their own way of using this field. But before county needs to submit a case, all the case need to be moved, all the investigation status need to be moved to complete. Otherwise, the submit button won't show up under jurisdiction section. And then next, this is the field that I was talking about earlier, is the outcome field. This field has a drop-down list of dead, survived, or unknown. And this is a field that determine whether this patient passed because of the condition. If I mark this as dead, and I click on save, if I go back to the demographic, the death field will automatically get updated to yes, because it doesn't make sense for someone to have an outcome of dead and the death field to be not dead. But if you have to put in date of death and death certificate number, you have to go under demographic section to put that information in, because we are trying to prevent conflicting information. So that's why. Oh, actually, let me refresh this page. So after you mark a case as dead, you can see that here, you will see a black ribbon. That's how you can indicate and you know that, okay, this patient passed away. So if you actually want to reach out to this person, we probably want to be more mindful, because it's probably the family member who pick up the phone or who respond to you. So we want to be more considerate when we reach out, if we know that this patient passed. All right, so here you can see that you can't type in date of death or death certificate here. You'll have to go back into the demographic. Okay, so next is reporting detail. So report, most of the fields in reporting detail are automatically filled in. If the record comes through ELR and was created as a case, it will always default to ELR. So reporting resources always default to ELR if it first come in as through ELR. Here I want to mention something. So you see that there is the reported to ADHS field. This field is only editable on the ADHS side. So you might have county reach out to you saying that, oh, they can't save a case because there are some built-in date validation that's saying that, oh, the date reported to ADHS is prior to one of the date that they put in, they can't save it. If it's something to do with the date reported to ADHS, you can fix it on your end. You just have to move the date to whichever date that was the validation was having problem with, either on that day or after a date after that date, to fix this issue. It's the same with report date to counties. If you happen to run into issue where you're trying to save and it said that the date report to county is prior to the other date that the validation is checking, go into the date reported to county and move it to that date that the validation is having issue with, or the day after. So in order to save your changes. Yeah. So an NMWR week and year is for all the morbidity. It's using the first reported date. So whichever date that is the first will be used to calculate an NMWR week and year. For COVID, we actually added a override date on the back end that the surveillance team has been updating so that the MMWR week and year can be recalculated correctly for COVID cases. The reason is because we're having a lot of issue with COVID cases because we are getting a lot of negative tests reported to us. And in the beginning of COVID, we are actually creating negative tests if there is a previously positive test into the system. So when we're doing merging, when we're cleaning data, we can have a lot of negative tests that shouldn't be counted, but are still in MEDSIS, and that will mess up with the date that was reported. So that's why we've added the override dates to the system to allow to force the MMWR calculation to recalculate. Next, we have outbreak. We will talk about this when we talk about outbreak module, so I'm going to skip that. For COVID, we're actually not using contact to do contact tracing. So this information is for all the other morbidity that has been using the contact section. So you can add contact to a case. However, in MEDSIS, contact can only go one direction. So you cannot, so one contact cannot have two index case or two parent case associated. But an index case can have multiple contacts associated under it. So let's say sample, let's see. So it's the same here. Wherever in MEDSIS that you need to type in a first name and last name, you always need to do a search. So it's the same here. You have to search to see if there's already an existing record or not. If there is, you can go ahead and click on the existing person record and then fill in additional information and click on save. And this is how the contact is associated to this index case. So Harry Potter is now the index case for this simple. Or you could, if you happen to search for this person and nothing comes up, you'll just go ahead and click on new person and then start filling out all their information. The requirement is the same for patient information. So first name, last name, date of birth, gender, address, patient primary county. You have the option to use the same index, the same address as an index case, or you can put, if it's different, you'll put that address in. But the one thing that's different for creating contact is that you don't need a disease report or a lab to create a contact. But I'm just going to cancel that. So I'm going to go into the contact case to show you what it looks like under the contact case. So when the contact is first created, you can see that the morbidity is actually showing as contact, but with the additional information which morbidity the contact is under. So you'll see it's under novel coronavirus and now. And if you scroll down to contact, you can see that it listed out the index case here. So this is the index case. This patient was exposed to by Harry Potter. Yeah, so that is how you can create a contact. And so if I go back, you can also associate an existing case to this index case. So let me, because I know Harry Potter has a COVID case, so that's why I searched for it. You can see that it will show up that, okay, there is a COVID case that the morbidity match up, so it shows up on the screen. So what I can do is I could just go ahead and click on the plus sign and to associate that Harry Potter case, COVID case, to this index case as a contact. Let's say you later on found out that, okay, this Harry Potter shouldn't be associated to this case, and you need to remove it. So for users, on the user's end, you can't remove any contact that has already been linked. So what you have to do is you'll have to email the MEDSIS help desk with the contact MEDSIS ID and the index case MEDSIS ID. If there's multiple contacts, list out all the contact MEDSIS ID, and then we will get the contact linkage removed for you. Yeah, so that's how you remove contact linkage. As we're in contact, I also want to mention contact is one of the few scenarios where it allows you to switch morbidity. If you remember, I mentioned earlier that most of the time you can't switch morbidity. Contact is one of the exceptions. So if once a contact is created and there's more investigation that was done to that contact record or contact, and it turned out that this contact actually become a case, that is when you will actually go into the morbidity section and change the morbidity to the actual morbidity. However, once you click on save, there is no take back. So you cannot change the morbidity from an actual case back to a contact. So just make sure that you are 100% sure that this case has become an actual case that needs to be changed to the actual morbidity. So I'm going to change this, save, and it's now grayed out. If I refresh and go back to the morbidity section, it is not, I don't have the contact option anymore. But because COVID is one of the exception as well, so we have a few different morbidity grouping, and COVID is one of them. COVID can be switched between COVID and SARS. We have flu and I think pediatric flu death. That's also a morbidity grouping. And opioid without fatality is also a morbidity grouping. Elevated blood lead, adult and child is also a morbidity grouping. that users can switch between morbidity. And this morbidity switch is only available for public health users, so county can't. Well, not county, but data entry or DE users can't. County can also update on their end. But I think most of the county folks don't do it. They will actually come to us and have us change it for them. But either way works. So those are a few exceptions that when you can actually change the morbidity. There's another exception that I'm going to talk about when we talk about outbreak module. Okay, so that is contact. Moving forward, I'm going to skip jurisdiction for now. I'll come back to that later. Next, I want to talk about case notification. I'm sorry, not case management. So under case management, there's actually a lot of different sections: investigator, investigation detail, case contact and interview, education, medical record, and there's a lot of other ones. And the travel table is also under case management. So let's say I need to assign this case to someone. How do I do that? This is where you will go to assign cases, is under case management and under investigator. So if you click add and you start typing names, let me see who is in Maricopa County. Okay, Sarah Cronster or Sarah Scott. So one thing that I want to mention is if you have an ADHS user role and you're under Maricopa County, you won't be able to find yourself under the investigator list, because this investigator list that will be showing up are only investigator who only has EPI at the Maricopa County user role. So you're not going to find your own name because you're ADHS, you're under ADHS. So I'm going to use Sarah's Cronster because I know her, and assign and click on assign to assign it to this person. You could always unassign this or they could also unassign themselves. But you can only assign to a person one time. So if it's still activated, if it's still assigned, you can't reassign it to this person. And you can't assign it again to the same person if they're already listed under the investigator. So what you have to do is you have to click into the edit icon and adjust the assigned date and the unassigned date. So if you want to assign it again, remove the unassigned date and click on save to reassign it. And then we have investigation, detail, case standing is where you can use this to document where you are with your investigation on this case. Most of you are mostly familiar with the work process for COVID, which we have a completely separate process for how we're dealing with COVID cases. So what I'm walking you through today is what functionality is there and what data is available, what section is available for you to capture data, and not necessarily how it should be used. So it's really depend on your program manager, your supervisor, how your program want to pursue with collecting all this information, or how you want to utilize all the section that's under the case management section to track your cases or track your progress. Yeah, so I just want to lay that out before I continue. Next is case contact and case contact and the interview table. So this table actually can track every single attempt that you made for this case. So if it's not, if it wasn't successful, you can put in as no, and then put the date in and save. And then you can add more. If you, two days later, you made another attempt, or a few hours later, you made another attempt, it actually was a success, and you actually did the standardized investigation or interview survey, you can check it, and if it's complete, you could mark as complete. If it's not, you probably want to add another attempt later. And then you could also document who actually interviewed this person, either local jurisdiction, you have a list, ADHS, a list, or other, if it's not listed, put the name in.
Amy, I've got a question. How much more do we have to cover? We're 10 minutes over.
Okay, we're almost done. Yeah, we're almost done. This is recorded, so if you have to drop off, feel free to drop off. But I do want to finish this part because we have a lot more to talk about on the other 3 sessions. So yeah, so I'm going to still continue, and whoever can stay, great. If you can't, feel free to drop off. And you could always just check back in the recorded training later. But yeah, so this is how you can document case interview and contact attempt. And I'm not going to go through all these because I just want to let you know that it's there. I'm not going to go through how you can use it. And then next, I'm going to jump into DSO. So like I said, DSO is disease specific. It's tied to the morbidity. So every single DSO looks different. That's why if you have to pull the data out, which we will talk about it when we talk about report and extract, you have to pull the data out separately. But the DSO is basically an electronic version of the disease investigation form that we had on our ADHS website. And it's usually also, it's really similar to the one that CDC had or CDC provides. It's just that we made it into the system so that everything could be recorded electronically. Yeah, so that's the DSO. I'm also not going to talk a whole lot about it. This one is a little bit different, but normally in most other DSO, the first question will be the more expect field, what we call more expect field. So it's like morbidity specific field, which is usually the stereotype or the type of what type of the disease that the patient got. So for example, for flu, it could be flu A, it could be flu B. Yeah, and that more expect field, whatever that got pulled into the more expect field that information will then get populated on the case card under the morbidity. Yeah, so that's the only thing I want to mention for DSO. So I'm going to move back up to jurisdiction. So now let's say, now I have finished up reviewing this case, and I've noticed that this is a Salt River Pima Maricopa case. I've reviewed the case. I've done what I could. I'm under Maricopa County. I've noticed that this is a Salt River Pima Maricopa case, which means that I probably want to transfer this over to Salt River Pima Maricopa. So what I need to do is I need to go to the jurisdiction section, click on transfer, and go down and find Salt River Pima Maricopa and click on transfer. It will ask me to confirm, and I click on yes. After the case is transferred, the system will automatically bring you back to the cases screen because you no longer have edit rights. How you can find this case is under Maricopa County is if you go under transfer cases. I think so. No, actually shared cases, sorry. Actually shared cases because we actually automatically kept the shared. So under shared cases, you will be able to bring up this case. And because I'm under Maricopa County, I can't edit anything. So now I'm actually going to switch over to Salt River, Pima, Maricopa. So now I'm under Salt River, Pima, Maricopa. Now I have edit rights. And if I go under jurisdiction, I can see that I automatically get a shared for Maricopa County. It's because this is a tribal case. So now let's say Salt River, Pima, Maricopa also reviewed it. Everything looks good. It could be submitted. County will have to go here, local classify it, or if you're working on behalf of the county or the tribe, you'll go ahead and fill in the state classification, and then move the investigation status to complete and click on save. Once you click on save and you navigate back down to the jurisdiction section, you will see submit to ADHS button show up. And this is how you submit a case to ADHS. So click on submit to ADHS, and it will tell you that it has been successfully submitted. After the case is submitted, if you're under local jurisdiction, it will take you back to the cases tab. So now, because it's submitted to ADHS, I'm going to switch back to ADHS Epi-Roll. And if I go back to cases tab and go under current cases and contact, I can see the case that was just submitted. And now when I open it, I can edit this case. And for ADHS folks, after you review, if you are responsible for reviewing cases, after review it, everything looks good, you have to go to state review and move it to yes, and state review. After the case is state reviewed, it is locked down. So you can't edit anything until you click on state review. If you have additional information that you need to add on to this case, you can always state review and pull the case back. Yeah, so that is how all the jurisdictional action works. And that is how you transfer, share, or submit a case. So if you are working on behalf of county or you're helping county on case investigation, you do have to follow the same process. The other thing I do want to mention real quick is if you have any cases that is assigned to you, you can actually find those under My Current Cases and Contact under the Cases tab. So it is always default to My Current Cases and Contact. So if you search under that criteria, any cases that is assigned to you will be listed under here. I don't have any cases assigned to me right now, so that's why I can't see anything. Yeah, but that is how you find your cases that you need to work on. And that is a really quick run through of new case entry and case edit. I don't know how many folks are still on the line, but I'm going to open up for questions.
Amy, I just wanted to clarify, when you were in the other jurisdiction, so whether it's tribal or county health department jurisdiction, you're actually going into that role to do the state classification before you submit to ADHS, is that right?
So it depends on your workflow.
Okay.
Yeah, it depends on your workflow. Yeah.
Okay.
Yeah, because sometimes it's easier because for ADHS folks, you are already working on it. So you probably just also want to just put it in and then transfer so that you don't have to go back and backfill those data. Yeah. I hope that helps.
Yeah, thank you. I might follow up with you on a couple of things just to make sure we're implementing it into our workflow. So
Okay, yeah, we could totally do that. All right, any other questions? Okay, if we don't have any questions, we're going to close out today's training. Again, thank you all for attending, and I will see you all next week.
thank you.
Thank
Thanks,
you.
Amy.
Thanks, Amy.
Thank you.